Fourth Healthcare Network is an organization dedicated to improving women's health and eradicating cervical cancer in our communities. We will explore the prevalence of cervical cancer in Nigeria, understand its impact, and discuss our strategic approach to combating this disease through screening, diagnosis, and advocacy. We aim to provide valuable insights and encourage collective action towards a healthier future for all women in Nigeria. Cervical cancer is a major public health concern globally and particularly in Nigeria. It is caused primarily by persistent infection with high-risk types of human papillomavirus, or HPV. This virus is transmitted through sexual contact and, in many cases, can lead to cervical cancer if not detected and treated early. In Nigeria, the burden of cervical cancer is particularly high due to a combination of factors, including limited access to healthcare, lack of awareness about the disease, and inadequate screening programs. The cervix, which is the lower part of the uterus that connects to the vagina, can develop precancerous changes when infected with high-risk HPV types. If these changes are not identified and managed early, they can progress to invasive cervical cancer. The good news is that cervical cancer is one of the most preventable and treatable forms of cancer, especially when detected early through regular screening. Despite this, cervical cancer remains the second most common cancer among women in Nigeria, with thousands of new cases diagnosed each year. It is also the leading cause of cancer deaths among Nigerian women, highlighting the urgent need for effective prevention and treatment strategies. To grasp the full extent of the cervical cancer crisis in Nigeria, it's crucial to look at the statistics. Cervical cancer is the second most common cancer among women in our country, trailing only behind breast cancer. According to recent estimates, approximately 14,943 new cases of cervical cancer are diagnosed annually in Nigeria. This high incidence rate underscores the widespread nature of the disease and the significant number of women affected by it each year. Furthermore, cervical cancer is the leading cause of cancer deaths among women in Nigeria. This alarming statistic is a stark reminder of the deadly impact this disease can have when it goes undetected and untreated. The mortality rate is particularly high due to late-stage diagnosis, which is often a result of inadequate screening and awareness programs. Many women do not seek medical help until the cancer has progressed to an advanced stage, where treatment options are limited and less effective. To put this into perspective, consider that cervical cancer claims more lives than many other cancers that affect women. For instance, while breast cancer has a higher incidence rate, it also has better survival rates due to early detection and more effective treatment protocols. In contrast, cervical cancer, though preventable and treatable, continues to claim a significant number of lives due to gaps in healthcare access and preventative measures. Comparing cervical cancer to other diseases, such as HIV, AIDS, and malaria, we see that while these diseases also have a significant impact, cervical cancer is unique in its preventability. HIV, AIDS, though a serious health issue, has seen significant advancements in treatment and prevention, leading to better management and lower mortality rates. Malaria, another prevalent disease, has widespread awareness and preventive measures like insecticide-treated nets and anti-malarial drugs. Cervical cancer, however, often does not receive the same level of attention and resources, despite the availability of effective vaccines and screening tests. These statistics highlight the critical need for enhanced awareness, improved screening programs, and comprehensive vaccination campaigns. Our goal at Fourth Healthcare Network is to address these gaps and ensure that every woman in Nigeria has the opportunity to protect herself against cervical cancer. By increasing access to screening and vaccination, and by educating communities about the importance of early detection, we can make a significant impact on reducing both the incidence and mortality of cervical cancer in Nigeria. Preventing cervical cancer is not only crucial for reducing mortality and morbidity but also for improving the overall quality of life for women across Nigeria. Cervical cancer is one of the few cancers that can be largely prevented through effective interventions. The primary method of prevention is the HPV vaccination. The human papillomavirus, HPV, is responsible for nearly all cases of cervical cancer. By vaccinating girls before they are exposed to the virus, ideally before they become sexually active, we can significantly reduce the risk of developing cervical cancer later in life. The World Health Organization, WHO, recommends that girls receive the HPV vaccine at ages 9 to 14. This early vaccination provides a strong immune response and ensures protection before any exposure to the virus. In Nigeria, increasing HPV vaccination coverage is a critical goal. Unfortunately, awareness about the vaccine and its benefits remains low, and there are misconceptions about its safety and efficacy. This is where education plays a vital role. By educating parents, guardians, and the community at large about the importance of HPV vaccination, we can increase acceptance and uptake. Schools, healthcare providers, and community leaders must collaborate to disseminate accurate information and dispel myths surrounding the vaccine. Regular screening is another key component of prevention. Screening allows for the early detection of precancerous changes in the cervix, which can be treated before they develop into cancer. The Pap smear test, or cytology, has been a proven method for reducing cervical cancer incidence and mortality in many countries. In Nigeria, however, regular screening is not as widespread as it should be. Barriers to screening include limited access to healthcare facilities, cultural stigma, and lack of awareness about the importance of regular checkups. To address these barriers, mobile screening units and community outreach programs are essential. These initiatives bring screening services directly to women in remote and underserved areas, ensuring that no one is left behind. By making screening accessible and convenient, we can encourage more women to participate in regular checkups. Additionally, educating women about the process and benefits of screening can alleviate fears and misconceptions, making them more likely to seek these services. Prevention also involves promoting healthy lifestyle choices. Educating women about the risk factors for cervical cancer, such as smoking and multiple sexual partners, can empower them to make informed decisions about their health. Encouraging safe sexual practices and the use of condoms can reduce the risk of HPV transmission. Nutrition and overall health maintenance also play a role in reducing cancer risk. A well-rounded approach to health education can foster a culture of proactive health management. Screening for cervical cancer is a critical step in our mission to save lives. Early detection through screening allows us to identify precancerous changes in the cervix before they develop into cancer. This early intervention can significantly reduce the incidence and mortality rates of cervical cancer. Our commitment to screening is unwavering, and we strive to make these services accessible to all women, regardless of their location or socioeconomic status. One of the main challenges in Nigeria is the limited access to screening services, especially in rural and underserved areas. Many women are unable to travel to healthcare facilities for regular checkups due to distance, cost, and other barriers. To overcome this challenge, we have implemented mobile screening units that bring these essential services directly to the communities. These units are equipped with the necessary tools and staffed by trained healthcare professionals who can perform screenings and provide immediate feedback. Our screening programs are designed to be comprehensive and inclusive. We collaborate with local organizations and community leaders to conduct outreach programs that raise awareness about the importance of regular screening. These outreach efforts include educational workshops, informational sessions, and community events where women can learn about cervical cancer and the benefits of early detection. By fostering a culture of proactive health management, we aim to empower women with the knowledge and resources they need to take charge of their health. The Pap smear test, or cytology, is a proven and effective method for cervical cancer screening. This test involves collecting cells from the cervix to look for any abnormalities that could indicate precancerous or cancerous changes. Regular Pap smears have been shown to significantly reduce cervical cancer incidence and mortality in many countries. In our screening programs, we prioritize providing high-quality pap smear tests to all women at risk. However, we understand that a single method may not be sufficient for everyone. Therefore, we also offer other screening methods, such as HPV DNA testing, which can detect the presence of high-risk HPV types that are most likely to cause cervical cancer. By offering a range of screening options, we can ensure that every woman receives the most appropriate and effective care. Beyond the technical aspects of screening, we place a strong emphasis on creating a supportive and compassionate environment for all women. Undergoing a screening test can be a daunting experience, especially for those who are unfamiliar with the process or have concerns about the results. Our healthcare professionals are trained not only to perform the tests but also to provide emotional support and counseling to help women feel comfortable and informed. Cervical cancer can be overwhelming, not only for those diagnosed but also for their families. At Fourth Healthcare Network, we understand the multifaceted impact of this diagnosis. Our approach is to provide care that covers physical, emotional, and psychological aspects, ensuring that patients receive the most holistic support possible. First, let's talk about the physical aspect. Effective management of cervical cancer starts with timely and accurate diagnosis. Upon diagnosis, we ensure that patients have access to a comprehensive roadmap for treatment. This involves understanding the extent of the cancer and tailoring a treatment plan that may include surgery, radiation, chemotherapy, or a combination of these treatments. We collaborate with leading medical professionals to ensure that our patients receive the highest standard of care. However, treating the physical symptoms is just one part of the equation. We also prioritize emotional and psychological support. A cancer diagnosis can bring about a myriad of emotions, including fear, anxiety, and depression. These emotional challenges can be as debilitating as the physical symptoms. That's why we provide counseling and support groups where patients can share their experiences and feelings in a safe and supportive environment. Our trained counselors and psychologists work closely with patients to help them navigate these emotional challenges, offering strategies to cope and thrive despite the diagnosis. Furthermore, we recognize the importance of providing support to family members and caregivers. They play a crucial role in the patient's journey and often face their own set of challenges. We offer educational programs and counseling services specifically designed for caregivers, helping them understand the disease and learn how to provide the best possible support to their loved ones. Our comprehensive care approach also includes palliative care, which focuses on improving the quality of life for patients at any stage of their illness. Palliative care is not just about end-of-life care, it's about managing symptoms, pain, and stress from the time of diagnosis and throughout treatment. Our palliative care team works to provide relief from the symptoms and side effects of cancer and its treatment, helping patients maintain a better quality of life. In addition, we have a strong focus on survivorship programs. For many women, surviving cervical cancer is just the beginning of a new journey. Our survivorship programs are designed to address the long-term effects of cancer treatment and help survivors transition back into their daily lives. This includes regular follow-ups, monitoring for recurrence, and support for ongoing health and wellness. At Fourth Healthcare Network, we believe that comprehensive care is a right, not a privilege. Every woman deserves to receive the best possible care and support, regardless of her socioeconomic status or geographical location. That's why we are committed to reaching out to underserved communities, ensuring that no woman is left behind in the fight against cervical cancer. Vaccination is a powerful tool in the fight against cervical cancer, and it lies at the heart of our strategy to prevent this disease. At Fourth Healthcare Network, we align our efforts with the global strategy for cervical cancer elimination, which aims to achieve significant milestones by 2030. These milestones are referred to as the 90-70-90 targets, and they are essential for reducing the incidence and impact of cervical cancer globally. So, what are these targets? The first target is to ensure that 90% of girls are fully vaccinated with the HPV vaccine by the age of 15. Human papillomavirus, or HPV, is the primary cause of cervical cancer. By vaccinating girls before they are exposed to the virus, we can drastically reduce the risk of developing cervical cancer later in life. The HPV vaccine is safe, effective, and a key preventive measure. Our vaccination outreach programs target various locations, including schools, community centers, and healthcare facilities. By focusing on schools, we can reach a large number of girls in the appropriate age group. We work closely with educational institutions to implement vaccination drives, ensuring that students receive the necessary doses of the vaccine. Additionally, we conduct educational sessions to inform students, teachers, and parents about the importance of the HPV vaccine and how it helps protect against cervical cancer. The second target is to screen 70% of women by the ages of 35 and 45. Screening is vital because it helps detect precancerous changes and early stages of cervical cancer, which are often asymptomatic. By identifying these changes early, we can intervene promptly and prevent the progression to invasive cancer. Our screening programs use methods such as the Pap smear and HPV DNA testing, and we make these services accessible through outreach and mobile units. The third target is to ensure that 90% of women with invasive cervical cancer receive effective management. This includes access to treatment, follow-up care, and support services. Our organization is dedicated to providing comprehensive care, as discussed previously, ensuring that women receive not only medical treatment but also emotional and psychological support. Reaching these targets requires collaboration and community engagement. We partner with local health departments, non-governmental organizations, and international bodies to amplify our efforts. Community engagement is crucial because it helps build trust and encourages participation in vaccination and screening programs. We involve community leaders, influencers, and healthcare workers to spread awareness and advocate for cervical cancer prevention. One of the key components of our vaccination outreach is education. We aim to dispel myths and misconceptions about the HPV vaccine. Misinformation can be a significant barrier to vaccination, so we provide accurate and evidence-based information to communities. We explain the benefits of the vaccine, address concerns about safety, and highlight the role of vaccination in preventing cervical cancer. Our commitment to vaccination is unwavering. By achieving high vaccination coverage, we can create a generation of individuals protected against HPV. This will lead to a significant reduction in cervical cancer cases and save countless lives. However, our efforts do not stop at vaccination. We continue to advocate for policies that support cervical cancer prevention, improve access to healthcare, and ensure that vaccination programs are sustainable. Our approach to screening goes beyond traditional healthcare settings. We understand that access to screening services can be a significant barrier, especially in underserved and rural communities. To address this, we collaborate with local organizations, conduct outreach programs, and utilize mobile screening units. These mobile units are equipped with the necessary tools and personnel to provide screening services right at the doorstep of communities. By bringing screening services to the people, we reduce barriers such as transportation, cost, and lack of awareness. Education is a critical component of our screening programs. We conduct awareness campaigns to inform women about the importance of regular screening and educate them on what to expect during the screening process. By demystifying screening and addressing any fears or misconceptions, we encourage more women to participate in our programs. Our screening programs are designed to be inclusive and accessible to all women, regardless of their socioeconomic status. We offer free or low-cost screening services to ensure that financial constraints do not prevent women from accessing these life-saving tests. Additionally, we provide follow-up care and support for women who receive abnormal results. This includes further diagnostic testing, treatment, and counseling services. We also emphasize the importance of regular screening throughout a woman's life. Cervical cancer can develop over many years, so it is crucial to have regular screenings even if previous results were normal. Our programs encourage women to follow the recommended screening intervals, which typically involve screening every 3 to 5 years, depending on age and previous results. Collaboration with healthcare providers is essential to the success of our screening programs. We work closely with doctors, nurses, and community health workers to ensure that they are trained in the latest screening techniques and best practices. This collaborative approach helps us maintain high standards of care and ensures that women receive accurate and reliable screening results. When it comes to combating this disease, early and accurate diagnosis plays a pivotal role. Cervical cancer is highly treatable when detected early, which makes the diagnosis phase a cornerstone of our comprehensive care approach. First, let's talk about the importance of early diagnosis. Cervical cancer usually develops slowly, starting as precancerous changes known as dysplasia. These changes can be detected through regular screenings, such as Pap smears or HPV tests. If left undetected and untreated, dysplasia can progress to invasive cervical cancer. This progression underscores the necessity of early detection. By catching abnormalities early, we can intervene before they develop into cancer, thereby significantly improving treatment outcomes and survival rates. When a woman receives a diagnosis of cervical cancer, it's a moment filled with uncertainty and fear. Our organization is dedicated to providing not only the medical expertise required but also the compassionate support needed to navigate this challenging journey. Once a diagnosis is confirmed, we take a comprehensive approach to determine the extent of the disease. This involves a series of diagnostic tests to assess the stage of cancer, which is crucial for developing an effective treatment plan. Staging tests may include imaging studies such as CT scans, MRI, or PET scans, and sometimes procedures like a colposcopy or biopsy. These tests help us understand whether the cancer is localized to the cervix or has spread to other parts of the body. Accurate staging is essential because it informs the choice of treatment and helps predict the prognosis. Now, let's discuss the emotional and psychological aspects of a cervical cancer diagnosis. Being diagnosed with cancer can be overwhelming. Patients often experience a range of emotions, from shock and denial to fear and anxiety. Our organization is here to provide unwavering support through these tough times. We believe that addressing the emotional and psychological well-being of our patients is just as important as treating the physical disease. We offer counseling services, support groups, and educational resources to help patients and their families cope with the diagnosis. Our team of healthcare professionals is trained to offer empathetic, patient-centered care. We ensure that patients are fully informed about their condition, the available treatment options, and what to expect moving forward. This empowers them to make informed decisions about their health and treatment. Moreover, we provide a roadmap for individuals diagnosed with cervical cancer, guiding them through the various stages of treatment and support. This includes coordinating care among different healthcare providers, managing appointments, and ensuring that patients have access to the necessary medical treatments and therapies. Our goal is to make the journey from diagnosis to treatment as seamless and supportive as possible. As we move forward, let's delve into two critical pillars of our mission: service provision and advocacy. These components are integral to our comprehensive approach in curbing the menace of cervical cancer in Nigeria. Starting with service provision, our organization is deeply committed to delivering compassionate and effective care to individuals affected by cervical cancer. Our service provision strategy encompasses a wide range of activities designed to support patients from the point of screening through to treatment and beyond. One of our primary services is the facilitation of accessible, high-quality screening programs. We utilize mobile screening units and collaborate with local healthcare providers to reach women in remote and underserved areas. These initiatives help to ensure that early detection services are available to everyone, regardless of their socioeconomic status or geographical location. Once a diagnosis is made, we provide a comprehensive care plan tailored to each patient's unique needs. This plan includes medical treatments such as surgery, radiation therapy, and chemotherapy, as well as holistic support services. We recognize that dealing with cervical cancer goes beyond just the physical treatment. Emotional, psychological, and social support are vital components of our care. Therefore, we offer counseling services, support groups, and patient education programs to help individuals and their families navigate the complexities of a cancer diagnosis and treatment. Now, let's transition to the advocacy aspect of our mission. Advocacy is about raising awareness, educating the public, and influencing policy to create a supportive environment for cervical cancer prevention and treatment. Our advocacy efforts aim to reach a larger percentage of the population with critical information about cervical cancer. We focus on educating individuals about the causes, natural history, and prevention strategies, empowering them to make informed decisions about their health. One of our key advocacy strategies is engaging with policymakers and healthcare professionals to promote policies that enhance cervical cancer prevention and care. We advocate for the inclusion of cervical cancer screening and HPV vaccination in national health programs. By doing so, we aim to ensure that these vital services are funded and accessible to all women across Nigeria. Community advocacy is another crucial component of our strategy. Through workshops, awareness campaigns, and collaborations with local influencers, we work to demystify cervical cancer, reduce stigma, and promote preventive measures. Our community advocacy programs are designed to foster open conversations about cervical cancer, breaking down barriers and creating a culture where individuals feel empowered to prioritize their health. We also focus on the ABC strategy for prevention: abstinence, being faithful, and condom use. While promoting vaccination and regular screenings, we also emphasize the importance of these behavioral strategies in reducing the risk of HPV infection, which is the primary cause of cervical cancer. In our advocacy efforts, collaboration is key. We actively seek partnerships with other NGOs, healthcare providers, educational institutions, and community organizations. By joining forces, we can amplify our impact and create a network of support that transcends traditional boundaries. This collaborative approach enables us to leverage resources, share knowledge, and implement comprehensive strategies to combat cervical cancer. Collaboration means working together with diverse partners who share our commitment to preventing cervical cancer. These partners include healthcare providers, businesses, educational institutions, community organizations, and government agencies. Each of these entities brings unique strengths and resources to the table, enhancing our collective ability to make a difference. Healthcare providers are crucial collaborators in our mission. By working with hospitals, clinics, and medical professionals, we ensure that our screening and treatment programs are of the highest quality. These partnerships enable us to offer specialized training for healthcare workers, ensuring they are equipped with the latest knowledge and techniques in cervical cancer prevention and care. Moreover, through these collaborations, we can expand our reach, providing services in both urban and rural areas. Businesses play a significant role in supporting our initiatives. Corporate social responsibility (CSR) programs often focus on health and wellness, making businesses valuable allies in our fight against cervical cancer. Companies can provide financial support, in-kind donations, and employee volunteers. Additionally, they can help spread awareness through their networks, reaching a broader audience and encouraging their employees and customers to participate in our programs. Educational institutions are vital partners in our advocacy and prevention efforts. Schools and universities are excellent platforms for educating young people about cervical cancer, the importance of HPV vaccination, and healthy lifestyle choices. By integrating our programs into the educational curriculum, we ensure that the next generation is well informed and proactive about their health. Community organizations, including local NGOs and women's groups, are instrumental in our outreach efforts. These organizations have deep roots in their communities and are trusted sources of information. By collaborating with them, we can effectively disseminate information, organize local events, and provide support to women at risk of or affected by cervical cancer. Government agencies and policymakers are essential collaborators in creating a supportive environment for cervical cancer prevention and treatment. Advocacy efforts aimed at these stakeholders focus on securing funding for cervical cancer programs, implementing national screening guidelines, and ensuring that HPV vaccines are included in public health initiatives. Through these efforts, we aim to create a sustainable and systemic approach to cervical cancer prevention. Collaboration extends beyond national borders. We actively participate in global initiatives and networks dedicated to cervical cancer elimination. By sharing best practices, research findings, and resources with international partners, we enhance our programs and contribute to the global fight against cervical cancer. This global perspective ensures that our strategies are aligned with international standards and that we are part of a larger movement working towards the same goal. At Fourth Healthcare Network, we believe that collaboration is not just beneficial but necessary. By joining forces with like-minded partners, we create a network of support that transcends traditional boundaries. This network allows us to leverage diverse expertise, resources, and perspectives, making our efforts more robust and effective. At Fourth Global Healthcare Network, we believe that everyone has a role to play in this critical endeavor. Whether you are an individual, a business, or part of an organization, your support and participation can make a significant difference. Let's explore the various ways you can contribute. Firstly, spreading awareness is one of the most impactful actions you can take. Educating yourself and others about cervical cancer, its prevention, and the importance of early detection can save lives. You can start by sharing information on social media, talking to friends and family, and participating in local awareness campaigns. By raising awareness, you help create a knowledgeable community that understands the importance of proactive health measures. Volunteering your time and skills is another excellent way to get involved. We have numerous opportunities for volunteers to support our programs and initiatives. Whether it's helping at a screening event, organizing educational workshops, or assisting with administrative tasks, your contribution is invaluable. Volunteering not only helps others but also provides you with the rewarding experience of making a tangible impact in your community. Financial support is crucial for sustaining and expanding our programs. Donations, whether large or small, enable us to provide free or low-cost screening services, purchase medical supplies, and conduct outreach activities. You can make a one-time donation or become a regular supporter by setting up monthly contributions. Every donation goes directly towards our efforts to combat cervical cancer and support affected individuals. Businesses can also play a pivotal role by partnering with us through their corporate social responsibility (CSR) programs. Companies can sponsor events, provide in-kind donations, or encourage their employees to volunteer. By aligning with our mission, businesses not only contribute to a worthy cause but also enhance their brand's reputation and employee morale. Advocacy is another powerful way to get involved. By advocating for policies that support cervical cancer prevention and treatment, you can help create systemic change. This might involve writing to your local representatives, participating in public health forums, or joining advocacy groups focused on women's health. Your voice can influence policy decisions and ensure that cervical cancer remains a public health priority. Community involvement is essential. You can organize or participate in local events such as health fairs, screening drives, and educational seminars. These events provide valuable information and services to the community, helping to break down barriers to healthcare access. By engaging with your community, you foster a culture of health awareness and support. Educational institutions can also contribute significantly. Schools and universities can integrate cervical cancer education into their curriculum, host awareness events, and encourage students to participate in vaccination programs. By educating the younger generation, we build a foundation for a healthier future. Healthcare professionals can support our mission by offering their expertise and services. Doctors, nurses, and other healthcare workers can volunteer at our clinics, provide training for our staff, and help develop educational materials. Their involvement ensures that our programs are of the highest quality and reach those who need them most. Getting involved with Fourth Healthcare Network is an opportunity to make a tangible difference. Whether you choose to spread awareness, volunteer your time, provide financial support, or advocate for policy changes, your contribution is invaluable. Together, we can create a future where cervical cancer is no longer a threat to the health and well-being of women in Nigeria. In conclusion, Fourth Healthcare Network is more than just an organization. It is a movement fueled by compassion, knowledge, and a shared commitment to defeating cervical cancer. We invite you to join us on this journey, to be a part of this transformative mission. Together, let's empower lives, spread hope, and create a future where cervical cancer is a thing of the past. Thank you for your attention and your dedication to this crucial cause.